Right. So welcome everyone. Thank you for attending our Dimension in Nursing Symposium series titled Breaking Barriers, Minority Males in the C-Suite. I'm the board chair of DNP's of Color, Dr. Dwayne Aline. So it's a pleasure to have you and then host this event tonight. Um, so briefly, I just want to talk about dimensions of nursing. What dimensions of nursing is about. Dimensions of nursing was actually birthed from conferences we had 2 years ago when we had a men's health panel discussing, and there was a lot of buzz, and especially when we talked about mental health, and we got approached by a lot of people. They wanted to see more um, topics on men's health or things dealing with men in nursing. So myself, Michael Williams, and Dr. Blue kind of got together and formed this group called Dimensions of Nursing. And the goals of Dimensions of Nursing is to, focus on either prospective nurses or men that are currently nurses or those that are thinking about nursing to be encouraged to reach the pinnacle of their profession. Me personally, I have not seen a lot of minority male nurse role models. I actually did not see any when I was getting my doctorate. So I want our purpose of this Dimensions of Nursing is to show our presence and give purpose to reaching the highest level of nursing care in the nursing field. So the purpose of this particular topic for showing minority male nurses in the C-suite is to show that despite obstacles or despite any doubts from others, we can be executives, we can be leaders. And the best way to do this is by showing leaders. So we compiled three top level minority nurses that I have the pleasure to interact with in one way or the other. Um, so I'll just kind of introduce them and you just wave your hand and I'll briefly turn it over to them. So first we have Captain James Dickens, who's a commissioned officer of the United States Public Health Service Commission Corps. So wave your hand, Dr. Dickens. And then we have Michael Todd Williams, who's the Vice President and Chief Operating Officer at Mercy San Juan Hospital, in Carmichael, California, which is a Commonspirit Health Hospital. And then last but not least, we have Dr. Joseph Veyra, who is the Chief Nursing Officer of NPhub, which is a platform dedicated to NP clinical placement. So at this time, I'll just kind of let the panelists introduce themselves and they can expand on what I mentioned about them and kind of give us a 3-minute introduction about how they got to their position of leadership. So we'll start with Dr. Captain James Dickens. Thank you.
Yeah, thank you, Dr. Aileen, for the warm welcome and introduction. And so I want to first say thank you to my colleagues for giving us the privilege of your time tonight. My elevator speech around my trajectory and what happened in my career. I started off as a bedpan commando in the military. We call them orderlies back in the day. For some of y'all, we don't want to date ourselves here, but I was a bedpan commando when we had metal bedpans. And then I progressed to the operating room, to paramedic, LVN 91 Charlie, went on to nursing school. So I took the lone circuitous route to get to the C-suite and get the experiences, but I wouldn't trade that for anything in the world. I became a registered nurse. I got my bachelor's at Hampton University, Hampton Institute, Hampton, Virginia. Then I did my master's there as well. I had an instructor that was, and God rest her soul, she was very intuitive. And I went to her and I said, I have an opportunity to go to somebody's a Hampton grad there, it looks like. But I went to this professor and I mentioned to her that, hey, I'm broke and destitute and I need to make some money. And I said, but I got this opportunity to go to this nurse practitioner program. HRSA has this scholarship mentorship program that they're trying to get more minorities in as providers, advanced practice providers. And she said, well, how long is the program? I said, well, it's probably about 2 years or 2.5 years if I'm slow. And she says, so how long have you been broke? I said, all my life. And she said, well, what's 2 more years? And really, I know that that was just her flippant comment, but that put a light bulb in my head. I was like, well, I wasn't on Skid Row or UTB under the bridge, but I was not making the money that I needed to make at that particular moment in time. And the 2 more years turned out to be the best decision that I could have ever made, and it has served me really, really well. I've had a trajectory in the U.S. Public Health Service, and I just want to be full disclosure. I retired after 29 years. At the end of last year. So probably I provided Dr. Aileen a old CV. I mean, an old resume. I mean, excuse me, bio. And I apologize for that, Dr. Aileen. But I retired December 2022, and where I had the privilege of coming back into CMS in my current job as a manager for CMS, and now I'm the director of emergency preparedness and life safety code for our survey and operations group. So I spend a lot of time in the C-suite. And you say, why are you here, James Dickens? Well, I spend a lot of time in the C-suite as officer in charge of a lot of missions across the world. I had an opportunity to go to Monrovia, Liberia, and led an Ebola mission for under our President Obama at the time. And it was an Ebola treatment unit. I spent about 4 months in Liberia there. Prior to that, I was in the war in Afghanistan, and I worked in the C-suite there for maternal child Rabia Bolki Hospital in Kabul, Afghanistan. And some of you all that are prior service that may resonate with you all. So I spent about 2 years traveling back and forth, setting up a women's health program in Kabul, Afghanistan. I've been to the USVI, St. Croix, working at a hospital there to get them back on track with CMS because they're a territory, and into Saipan. And the last 3 big missions that I had the privilege of being the officer in charge of was the unaccompanied children along the U.S.-Mexico border at the time under President Trump when he was 45, the 45th president at that time. And then we had the unaccompanied, the Afghan refugees that when Kabul fell or Afghan fell, we had 100,000 refugees across the world on lily pads. And we were able to get a lot of those folks back to the United States that had helped us for 20 years during the war. And then the other one was I worked at NIH with Dr. Fauci and those guys distributing the vaccine all over the country. So those are many missions that I had. And so I've always been in and around the C-suite for some reason. And I know some of us don't even remember what the C-suite means. That's where all the chiefs sat, the chief of nursing or the chief of med surg, the chief of whatever. And so it became synonymous. And I don't think any of us use that anymore. It's the C-suite. It's just known as the C-suite. So I'll stop there. And I know I missed a big gap of my trajectory along the way, but I'll weave that into the conversation as we move forward. And I'll turn it over to my next colleague, Dr. Aileen. Back to you, Stan.
All right, Dr. Michael T. Williams.
All right, thank you. Thank you for having me. I echo Dr. Dickens' comments. It's an honor to be here and to be with you and to have an opportunity to talk about my trajectory and answer questions that you may have. Not as esteemed as Dr. Dickens, but mine's probably a little bit more simple. My first assignment, 90 days out of nursing school and on the floor, I was in charge. And from there, my career has really been one of first. So my hospital, it had been in existence for well over 100 years. And so I was the first male minority director at the hospital. And I made that leap right about 3 years or so. And from there, I had the opportunity to really just oversee a number of nursing units, from case management to ICUs to med surg to tele units and things of that nature, float pool. And from there, I tried to stay in the nursing track, to be honest with you, but it really wasn't laid out for me to remain in the nursing track. And so we had a chief operating officer there. It was about 8 years into my career, and I went to him and I just simply said, "Hey, I want your job." And so and he looked surprised. We didn't have succession planning at the time. And he was honest with me. He said, I don't know how to help you. I've never really taken anyone, to really try to mentor. And so I just kind of developed my own little program. I just go sit with them every Friday, just ask them questions. And that actually materialized to him then really giving me opportunities to sit in meetings with him and giving me assignments and things of that nature, which allowed me to grow and learn. And then right about 8 years, 8.5 years, I took over, as the interim. And so I was the interim COO, and I did that interim stint for about roughly about 8 months or so. And he had actually gone out on medical leave. He came back, but he didn't come back. And I was doing his job, and no one knew I was doing his job. And that's when I knew that, I knew I had the skill set to do that, because if no one knew that I was doing his job, it was a sign. And so from there, I became the chief operating officer, and I've held that role now for about 7 years or so. So it's been, one hospital for the most part. I just recently transferred to Mercy San Juan from St. Joe's with Dr. Blue, and it's been a great thing for me. So like I said, it's not as I think as exciting as Dr. Dickens, but it was filled with first, and I was the first minority male executive in that hospital, and it's over 100 years of existence. So my career trajectory was filled with a lot of first, and so that's my trajectory there. And I'll pass it back over to you, Dr. Aileen.
Thank you, thank you. All right, now Dr. Joseph De Veyra, to kind of tell us about your journey to leadership.
Hi, everyone. My name is Joseph. First of all, it's an honor to be a part of this illustrious group. So my name is Joseph, first-generation immigrant from the Philippines. Started as a CNA. Also, I foresee nursing as a social mobility engine. And with luck, I was able to get into a free program from LA Unified School District for an LVN program. And my clinical experience comes from the VA. I worked as a progressive care unit charge nurse and as a clinical nurse leader for the geropsych unit. After that, I eventually worked initially as a clinical project manager for Medicare Quality, for the Medicare Quality Improvement Organization for California, and was promoted to executive director after 3 years. And during that time, I had oversight over the quality metrics of 314 hospitals. Then a little thing happened, the pandemic, and I wanted to be more in the action. So I took a role in Harborview Medical Center for University of Washington Medicine. Not sure does anyone know the show Grey's Anatomy by any chance? So the inspiration behind that show was the hospital that I led during the pandemic, because it's the only level 1 trauma center in 4 states, namely Washington, Alaska, Montana, and Idaho. Hopefully the inspiration behind the trauma cases and not the drama, but as you can see, it was pretty intense, just because Seattle was also ground zero for the pandemic. And I just wanted to get back to the mission and really be back in the action. During this time, I led the hospital through their first magnet designation and also decreased our RN vacancy rate from 16% to 3%. It was actually during this time wherein I found my why. I was getting a lot of random calls from NP students from North Dakota, New Mexico, and Boston asking for clinical placements. And for me, the best way to learn about something is to write about it. Serendipitously, I was in my MPH program in Harvard University during that time. So I wrote this research paper, discovered that there's going to be 120,000 shortfall in physicians by 2030. And the key to solving that, according to the Future of Nursing Workforce Report, is optimizing the NP pipeline. So from there, I was able to network with this organization called NPhub, doing things the right way. And I now serve as the Chief Nursing Officer for NPhub and built academic partnerships with key universities such as Yale, USC, and Graceland University. And we also built the first ever NP-specific job board called NPHire, which is used by UCLA, Stanford, and Penn Medicine, to name a few. I also have a DNP from Cal State University and an MBA from MIT.
All right, thank you. And I forgot to say a few things in my introduction, and one of the things is that if you have any questions during this presentation, feel free to leave it in the chat. So we'll kind of keep track of that. Also, just to let you know, after the end of this program, we will have an open Q&A as well. So feel free to ask questions at this time, okay? So I appreciate you guys for all showing up. I also want to recognize mostly, this is a men's group, but we always get the support of the females. I can tell you, so I'm proud of y'all. Y'all always lift me up. So without y'all, we wouldn't be here. So appreciate this. Want to shout out to all y'all for always showing us support and love. So I'm going to start with some questions for the panelists, and I'll start with Captain Dickens. So Captain Dickens, so what unique challenges do you face as a minority male nurse trying to climb the corporate ladder?
Boy, I'm always misconstrued as the help. And I know some of us have that imposter syndrome, right? We walk into these spaces and they're like, excuse me, are you in the right place, or should you be here? And I want to tell them that, I'm double fellowed. I'm a fellow of American Academy of Nurses. I'm a fellow of American Nurse Practitioner Association. I'm a board. I've been a regional board member for the American Association of Nurse Practitioners. And I've done all these things, but I try to let my work speak for itself, and that I'm not, I belong in those spaces. And so I would tell you, imposter syndrome, one of the things that you get a lot is a double take, and you feel like you're a misfit. You question yourself, should you be in these spaces? And I think Dr. Williams kind of alluded to that. The mentorship, not having brown faces in these spaces, so to speak, right? I feel like I'm a poet here now. I'm rapping a little bit, but you don't, we talk about not having the faces to help you in our trajectory and what have you. So I've had imposter syndrome, and I've had to really deal with that over time as I've moved up, and people question your ability to be able to do the work. I'm not a minority hire, right? I've talked about the HBCU, Hampton University, but I have my doctorate from Texas Tech, and I've been fortunate that the military has paid for most of those degrees, or all of those degrees, in one form or another. So I've maximized my opportunities as well. And so I'll stop there and turn it back over to you, Dr. Aileen.
I'd like to pose the same question to Dr. Veyra.
I think that the key difficulty is, especially when you're in the boardroom, not a lot of people will look like you. And it's very difficult because aside from the strategic imperatives of the organization, you're not able to relate with your colleagues. And just coming from me, English is my second language, and I'm a first-generation immigrant from the Philippines. So whenever I'm presenting, if there's like a lag or a 1 second delay, it's because people don't recognize that I'm actually thinking about the questions in my native language first before translating it back. So I think those are just some of the key difficulties that not a lot of people recognize and realize.
Thank you. And then Dr. Williams.
First, for me, first, people don't even know I'm a nurse. They don't even think I'm a nurse. And so I think for me, it was interesting that, when they find out I'm a nurse, they're actually surprised. And because we simply, as a male, they don't expect that we could be nurses, and that we could fill that role, that we could be empathetic and caring. And so it was always interesting that, that they would be surprised to find that I was a nurse. And so it's been that way. I agree with Dr. DeVere that, making that transition into the C-suite and being in the C-suite and then not really being able to connect, the awkwardness in some of our meetings, how they had to basically think about what they were going to say, how they had to change the conversation. And it still continues, because when I look at our system and across the board, there's just not a lot of minority males, in the C-suite, and so and that, especially that are nurses. So it was challenging at first, but you have to just learn to just stand your ground.
And Dr. Aileen, I'd just like to capitalize off what Dr. Williams and Dr. DeVere mentioned. We're not from the good old boys network or good old girls, flat-shoed, gray-haired, Caucasian female as nurses. We're not from typically in those clubs, and we've never been invited to the country club dinners and all the parties after the party and the meeting before the meeting. And so you have to find your voice, and I put that in there because a lot of times our voice isn't heard. And so we have the subject matter expertise, and we have to leverage that when we are at the table. And I think there's a saying with Shirley Chisholm: if they don't give you a table give you a chair at the table, bring your own damn chair. So, you know, you just need to be heard and be visible in those spaces. Over.
Something I'd like to add as well is that you really need to be intentional in creating your presence in the boardroom, because what I learned is that if you're not at the table, you're on the menu. Unfortunately, I have the scar tissue to show for that as well. So it's really important for you to be very intentional to make sure that you are included in those spaces.
And you're right, Dr. Veyra. If you're not invited to dinner, that's because you are dinner.
Yep, I agree. So you gotta push, you gotta bring your own chair and push your way to the head of the table, because they'll keep you back if you just sit there and take it. So,
But you don't have to change. You can still be yourself, you know. And if you don't want to go to dinner, then don't go to dinner.
Absolutely, absolutely. Don't acquiesce, and don't be forced into. And I think Dr. Veyra talked about that, being intentional about what you do. Over.
all right. Now I'm going to direct this question to Dr. Michael Williams. So how did your nursing background contribute to your success in your executive roles?
You know, as I said, you know, I took advantage of the opportunities, you know, being a nurse leader, you know, by going to case management and taking on nursing units, and really that allowed me to be comfortable in any setting. And so not only, you know, from a clinical perspective, but then really having a good understanding of, you know, the entire process as it relates to healthcare. I had the opportunity to do Lean Six Sigma in the hospital. And so as a nursing director, and, you know, running multidisciplinary teams, learning every process step of the hospital, learning every process step, you know, from when a patient enters the door until when they walk out of the door, until when their bill is dropped. And so, you know, having that clinical knowledge, having all the experiences. We were at our hospital was a hospital that always talked about experience. You know, you needed 20 plus years to promote. And I took on the attitude of, no, you need experiences. You need to be well-rounded and have a good understanding of how healthcare works, you know, to be able to have that nice trajectory, and so that you're comfortable in all these various spaces and you can speak all the various languages as it relates to healthcare.
And I'll ask Captain Dickens the same question, like a pivotal moment how did your nursing background contribute to your success in your executive roles?
Well, as Dr. Williams mentioned, nursing is my dadgum superpower. If you don't know about me, it's shame on you, because I'm coming. I'm like what Deion Sanders at Colorado. I'm coming. It's my superpower. And I didn't take Lean Six Sigma, but Hampton taught me one thing: the nursing process: assess, plan, implement, evaluate. That's what I do every day, all day. I take it everywhere I go. I implement it with everything I do. And let me tell you, you can put some lipstick on that pig, and I'm not trying to be misogynistic. You can do whatever, get it a haircut, get it a nice fade, but it still boils down to those things: assessment, planning, implementation, and evaluation. Rinse and repeat, baby. So that's what I would tell you: the patient-centeredness, the critical thinking, understanding the complex systems that Dr. Williams mentioned and Dr. Veyra mentioned. It's my superpower. I just need a cape. Over.
That's right. So I'm going to ask a new question to Dr. Veyra. So Dr. Veyra, can share with us a pivotal moment that propelled your career forward? Because it's always all of us can attest to some type of pivotal moment. So interesting to hear from you in that regard.
I think a pivotal moment in my career was working at the VA as a clinical nurse leader for the geropsych unit. And I also want to take the chance to say to Captain Dickens, thank you for your service. There is no greater honor than serving those that provide the liberties we enjoy. So during my tenure at the VA at the geropsych unit, one of the key quality metrics that we had difficulty with was the high rate of restraints and seclusions. And from there, a pivotal moment was I was actually working on my DNP in Cal State University as well. So I leveraged that to conduct a literature review and discovered that there is this intervention called multisensory stimulation. The simplest way I can explain this is we designed an intervention that normally when a veteran was having a high level of anxiety or an episode, the first intervention is leveraging pharmacological interventions or restraints or seclusions, which obviously does not raise the standards of care. So I was almost very innocent of how difficult it is to write a grant, pilot an intervention. So upon that literature review, I wrote a grant to the VA Center for Innovation to get high-tech multisensory stimulation equipment. And thankfully, we got $200,000 worth of high-tech equipment. The simplest way I can explain it is it's a nurse-driven intervention that can be customized based on the needs of the veteran. So for example, the veteran was a former fisherman. When they go into this room, they would see the sight of the sea, hear the sound of the sea, and even smell the scent of the sea, inspiring reminiscence in the process. Long story short, after a year, we were able to decrease our restraints and seclusions from 30 a year to 0. And we eventually won a National Strong Practice Project Award. And I believe that clinical experience and that project that I piloted eventually propelled me to different opportunities, such as working for the CMS Quality Improvement Organization. So mission first, and then the outcomes will follow.
All right, same question to you, Dr. Michael Williams.
I think for me, it was just being told no. Yeah, I got to a point, as a director, and, I wanted to ascend into the executive realm, and I was told no. And I just did some self-reflection, honestly, and said, what do I need to do to make that next step? And so I didn't view failure as a quote unquote negative. I viewed it as a positive because it was an opportunity for me to move forward. And so I think the best thing that really happened to me was to be told no. My first time, I was told no, and I was told no my second time, and that's okay. It's like I said, it gave me an opportunity to do self-reflection, to really figure out what those opportunities are, and to ask the right questions, because I didn't just accept no. I asked, why did you tell me no? And from there, I learned, and I continued to grow from that, and just didn't take no as the final, and didn't see no as a failure. I really did, I saw it as a positive and just tried to move forward. So being told no is not a bad thing. Failure is not a bad thing. It's just an opportunity for us to get better. And I think if you view failure and no's as negatives, you're really not going to be able to progress forward. You have to keep moving forward. The doors are open. It may not seem that way. We need to just walk through the doors and not complain about how wide the door is open. If the door has a crack in it, just walk.
Yeah, and I like that turning negativity to positivity, because that was my pivotal moment as well, when I was told I can't, and I did. So Dr. Dickens, I want to hear from you about your pivotal moment that propelled your career forward.
Well, one of the things the uniform is notorious about, if you have a major operational failure, heads roll typically. If you've known anything about the government or the VA, they want to hold somebody accountable. And so I was the beneficiary of someone that had a major operational failure, and I've been known to come in and clean up the mess. I'm a fixer. I make things happen. And I use a little known leadership strategy. I subscribe to the Redden 3D model of leadership, which is using the appropriate leadership style to get the desired results. However, there's one that they don't talk about much in the literature. It's called the push, pull, or drag method. And so I will push you, pull you, or drag you to get the objective accomplished. And I think one of my esteemed colleagues spoke to staying focused on the mission. And that's what I tell people. Even right now, I had a conversation with my senior leadership, my executive leadership today. And I said, this is what we're going through is organizational change. Change is tough under the ideal situation, and we need to address it. We need to pull out John Maxwell, Simon Sinek, all the major thought leaders around change and embracing change, because that's what this is. But we need to keep it patient-centered at CMS. And I know my colleague talked about being with the QIO. We're patient-centered. The patient should be at the center of what we do. and this has changed. And I do agree with Dr. Williams regarding no. No is easy, because I think Theodore Roosevelt speaks to the fact of the man in the arena. It's not the man in the arena who's marred, right, from failures and being told no. It's the one that never tried. And I say man as, you know, as person, but a man or a woman in the arena, it's not him being knocked down and being marred by being told no. It's him or her that doesn't even try, that doesn't even lift a finger, that just take no as a, you know, no one's ever done it. Dr. Williams alluded to the fact that he was the first in a lot of spaces. And how many of us can say that? Maybe a few, maybe a lot. I don't know. But at this point, the 21st century, we shouldn't be the first, unfortunately, but we are. And so that's the major operational failures have been where I've come in to do the cleanup and where I've kind of gotten my brand, so to speak, to fix things, but also being a minority that's going to live his creed and not live up to the expectations of what, or exceed those expectations. And I think there's another quote that says, there's no man that's dead, live, or yet to be born that should do this job better than you. And every day I wake up, when my feet hit the floor, I walk with that mantra on me, that no man or woman, dead or alive, or yet to be born, will do it better than me. And do I fall short? Absolutely. I keep this book here. Sometimes I journal, and sometimes I journal with 4-letter words, but I journal every day. Sometimes they're a little bit more detailed, but some days they're 4-letter words. That's all I can get in here. But that's what motivates me. And I go back and I look at these, and I got a bookshelf full of them on my bookshelf that I've been doing this for years. And so that's all I have, Dr. Aileen, on this one.
Thank you, Dr. Dickens. Dr. Williams, so we're just going to pivot to talk about representation and diversity in nursing. So since you became a leader, how has the landscape changed for minority male nurses?
I think that depends on where you're, on what level you're looking at. You know, I can say, you know, at the hospital level, I at least in my system, not very much. I think at some of our most senior levels, we see a lot of that. And then once you get to those most senior levels and you fall in between there's not a lot. You know, I used to subscribe to what Dr. Dickens say. It is a little bit of a kind of a good old boy network. There's a lot of connections, you know, and there's a lot of recycling of leaders at that level. And so those opportunities really don't present themselves, you know, for the minority leaders or male minority leaders to kind of, you know, to motivate and escalate up to that level. And so I think that's one thing that I've seen. I was one of few at our hospital, and now Dr. Blue's one of few at the hospital. And so those opportunities, you know, really don't present themselves. I think we're still in the era of, you know, the good old boy network and recycling of leaders, and until that time presents itself where we have those opportunities and we're ready to really make that next step, you know, I think there's not much change for me anyway. That's been my observations.
Yeah, that's very concerning. Dr. Veyra, how about you?
I truly agree, because obviously we've been in those situations where a position opens up and it's almost that the outcome has been has been made already, even before the interview, even, or maybe even before they post the position. So I think as a minority or a minority nurse leader, you really need to make sure that you're able to demonstrate your effectiveness. A strategy without data is just poetry, right? So what you really need to do is you really need to know your numbers. And from a nursing standpoint, the key is learning the nurse-sensitive indicators that your organization cares about. If you're able to put yourself and be intentional in the manner by which you are able to lead these projects that affect these nurse-sensitive indicators, as my colleague said, the outcomes will speak for themselves, and you will eventually see that opening.
Okay, thank you. All right, this question is for Dr. Dickens. So what strategies have you implemented to promote diversity in organizations that you've been part of as a leader?
So that's a great question, and I was just feverishly typing, trying to opine on some of the things that our colleagues have mentioned here. And I would tell you, blinded resumes. One of the things I've demanded when I became a fellow with the AANP. If you were the dean of nursing school at Johns Hopkins or San Francisco, one of the bigger schools, one of the more broader schools, and you endorsed somebody for a fellow, it was automatic. Right? Not necessarily based on the body of work. And so we have people that have the body of work, minority candidates that are on this line that came up for fellow, and now those things are blinded, right? And that's what I've done for my interviews. I just hired a young lady. We just hired a young lady, and but the team was primarily looked like a bowl of milk, homogenous, right? And we were able to blind it and do it in such a way that and got a panel that was reflective of what we were looking for, and we were able to hire the best qualified candidate, right? And so those are the things that I've done. Use the data, diverse hiring panels, structured interviews that no one gets the advantage. And I love the cup of milk Dr. McCammy's put in the chat if you guys are looking at that. But you're right, it's homogenous like a bowl of milk, Dr. McCammy, and thank you for that. So, and it cracks me up because I want to laugh a lot louder than I can here. But that's what comes to mind for me. Also, I serve as the former chair of the AANP DEI committee, and I'm on the EDI committee for the Academy of Nurses. So I let my voice be heard. I use my platform to advocate for minority males. I also take students, interns, Dr. Williams, the young Dr. Williams, versus the Dr. Williams 1. Dr. Williams 2 interned or was with me as a DNP when he was going through his program because he had some challenges. And I said, and Dr. McCammy hooked him up with me, and we were able to get him through his program and meet all his metrics for graduation. He had some challenges here in the great nation of Texas, and we were able to see that through. And so those are the things that I do personally. This summer through our junior co-step program for the United States Public Health Service, I have 3 candidates, and I'm happy to say it's it's 3 females, and they're all minorities. And so I do my part in my space, you know, from where I sit, and everyone can do something. If you're a hiring authority, you can do something. If you're on a panel, you can do something. If you're reviewing resumes, you can do something. And so that would be my charge to each one of us. Where you are, lead from where you are. Dr. Aileen, back to you.
Thank you. So I'm going to address this question to Michael Williams 1. So how do you address unconscious bias in hiring and promotion practices in your setting?
You know, I think the first thing I do is I always, you know, really, much like Dr. Dickens, you know, I really do resume reviews. I really, you know, call out that, you know, we need not to really be focused on, you know, the physical attributes of the person, but really be focused on the qualifications, and then, you know, and then really to evaluate those closely. You know, I also, you know, I will purposely, you know, and be very forceful in meeting with, you know, our candidates, you know, that are, you know, that have let me know that they're applied for positions, and sitting down, you know, to work with them and to make sure that they're well prepared for interviews. But, you know, I think the biggest thing is really, you know, to be, as Dr. Dickens said, be a part of those panels, to be there, to be that voice of reason, you know, not allow or at least speak up when we see that those biases are being spoke on on the panels. And really, you know, we do have to do our part. We do need to be a part of those committees, whether you like it or not. Yes, it does take time, but we need to be a part of that. We need to have a voice. You need to have a voice. You need to speak up, and you need to make sure that these processes are very fair.
Thank you. And Dr. Veyra, how do you address unconscious bias in hiring and promotion practices in your organization?
I think it's at the heart of our mission in NPHire. One of the key projects that we piloted was the first ever NP specific job board. And as you know, unfortunately, your demographic profile can be weaponized against you. And what, based on my lens, is I wanted it to become a superpower rather than a liability. So we leverage our AI to actually increase the chances of a candidate being hired in the event that they're able to speak the preferred language of that diverse population that they serve in. Because I truly believe, as a first-generation immigrant, patients deserve to be served by people who look and who look like them, because they understand the context. For example, right, my parents, they're not. They might say that their pain is a 0 out of 10, but in reality, it's probably a 10 out of 10. So by having that context and having that direct connection to the communities, you're able to advocate and serve your patients better.
Thank you. So so I'm gonna move on to Michael Williams too. So he's gonna take over and we're gonna start getting some insight on mentorship and support.
Thank you, Dwayne. As was said, I'm Michael Williams, number 2. I gotta lend way to the OG, the original Michael Williams in the field, right? So salute. Um, I'll be kind of touching on just what mentorship looks like for you fellas. But before, I'd be remiss to say, as Captain Dickens said, I was in a tough place. Danielle got a message from God that said, tap him in to Captain Dickens, and I don't know if that was meant to be, but if you put me and him in a room together, it's gonna be an interesting conversation, and we both a good healthy crazy, I would say. So so shout out to Captain Dickens, who is one of my mentors in this great profession. But I like to start with you, Captain Dickens, because who was your mentor? What was that key situation that maybe you made into a mentorship that kind of had a great influence on your career? And then you other fellows will answer.
Yeah, thank you, Dr. Williams. And mentoring you wasn't a problem. I mean, you were one of the, and I speak about Dr. Williams, and it was serendipitous that Dr. McCamey put us together. And I don't think we've been apart since. You were in the student role. You were always working. I akin to you fighting above your pay grade or fighting above your weight class. He was always fighting above his weight class. So you were easy to mentor. You knew what you wanted to do. And mine was just kind of providing bumpers, like when the kids bowl and they don't get a gutter ball, to make sure you weren't getting any gutter balls, and you've exceeded expectations, and I know you'll continue to do great things. But for me, mentors, I've had mentors all along my career. Some very bad, but I still learned from them. Right? I took lessons like, I don't want to be that kind of leader. I will not be that kind of nurse or medical provider. I will not treat patients that way. I will get on that level, like Dr. Veyra mentioned. And so I have nursing mentors. I have physician mentors. I have business mentors, because that's not something that comes to me just organically. So I have mentors all over the place that I've utilized their skill set to hone my own knife, or to put another arrow in my quiver. And what have you. So I don't think you can have too many mentors. I don't think they all should be homogenous, all be nurses or nurse practitioners. I think you need to figure out what you're doing, inventory assessment of where you are professionally. I think Dr. Williams alluded to that. Dr. Williams 1 alluded to that and talked about his weaknesses, and he went all over the hospital to learn every aspect of it. I know for me, budgeting, I don't know jack about budgeting, particularly government budgeting. Well, guess what I did? I got with a finance person and someone that with an MBA that could break it down in Louisiana education terms that I would understand, right? Because I have that limited education from the 49th state. We to say thank God for Mississippi in terms of education, for public education anyway. But I got with people that could help me hone my skill set, whether it was public speaking, whether it was writing, writing in the Queen's English and not in the Louisiana broken English that I brought to the table. So those are things that I would encourage you to do. seek out the people that where your trajectory is where you want to go and where your trajectory is going to take you. You find the experts in those areas and you do some cold calls. But when Dr. McCamey knocked on my door and said, "Hey, I got this guy," I'm like, done and done. And we just had to work out the details to figure out how to make this work for you, right? But I know Dr. McCamey, and I know the type of people that she attracts, right? So it's not even an ask. It's just like, "Hey, I need you to do this." Done. No question. Done. Do you have enough time? None of that was asked, because we know that she's not going to send me somebody that doesn't have a upward mobility or upward trajectory for this discipline, for the role of the nurse, and I mean the discipline of nursing and the role of the nurse practitioner. I know that. So that's all I have. I want to leave some time. Like you said, we'll suck up the oxygen in the room here, Mike, when we get together.
Thank you, Captain Dickens. Dr. Veyra, if you would please go ahead and kind of just give us your key mentor and how that shaped your career.
I think when you say mentor, it's a very interesting word because it's someone who gives you guidance. But I think aside from a mentor, what I really needed early in my career was a sponsor, someone who would open doors for me. And that person is my nurse manager at the geropsych unit at VA Long Beach. Her name is Gina de los Reyes. And when I was talking about this is because she, instead of limiting me or hindering me from piloting that multi-sensory stimulation project, she actually celebrated it, because I'm sure we've all been in these spaces where, hey, slow your roll, stay in your swim lane. I think that a great metaphor I heard is that you're not in your weight class. So I think it's really imperative. Of course, mentors are important, but it is imperative to find a sponsor, someone who will actually put their name out for you and open those doors.
Excellent, excellent. Thank you for sharing that. I need a few sponsors if there's anybody with a lot of money, $1 million in the chat. But I want to leave it to the OG, Dr. Michael Williams. Please share your insight with us.
I would have to say, I don't even think he would call himself my mentor. As I said, I went to the chief operating officer and said, I wanted your job, and basically, put him in a position to help me, to ask questions. But I'll also say that, along the way, as Dr. Dickens said, I went to people not necessarily that were above me, but that were below me, that had the information, that we would call subject matter experts, and got the information from them. And in essence, they mentored me by providing me, knowledge, really showing me the way. And so it went both ways, and so I think when you look for people, to be mentors or colleagues, I echo Dr. Dickens' points, which is, they don't necessarily need to be elevated above you. They can be below you, they can be next to you. When you're making this journey, you need knowledge and information. And sometimes you need direction, and sometimes you do need someone to tell you, that's not the right way to do it. That's not the way to proceed. And that can come from any level, but you have to be open to it and to hearing those messages. And so, be open to, not just being mentored, but having good relationships that you can actually benefit from.
And Mike, I'd like to just opine on what Dr. Williams mentioned. This thing has to be bi-directional, right? The reason I mentor or the reason we teach is because I learn as much from you. You taught me about the electronic business cards. I'm still running around with paper in my pocket, right? At that point, I didn't know you could do the touch the phones and transfer. I'm old school. I'm an OG, right? I'm out of the network. And you like, yeah, we need to bring you into the 21st century. So I learn as much from you all as I get as much from mentoring or teaching as I do, that as you all get from us. And so you have to be, Dr. Williams mentioned, you have to be receptive to receiving it, right? And not saying that, oh, Dr. Veyra, he's not at my level. I'm a this, that, and the other. No, absolutely not. You have to be open to receive that, because you may be blocking a blessing to take from my biblical colleagues. You may be blocking a true blessing from somebody that's putting something in your life. Anyway, I'll stop there.
No, thank you for that. I think one of the themes I heard just on this was just sometimes you got to make a you got to make a mentor, because I think Dr. DeVere used a good word about sponsorship. So that's such a powerful message. Now, and Dr. Dickens, you touched on that a little bit, but how, I guess, how do you all think, or how have y'all been paying it forward as far as for Black and Brown, male nurses who are looking to move up? Any insight on what y'all have done to kind of, facilitate that? And I'll start. I'll have Dr. Michael Williams start with that, if you can.
Obviously, that the term open door, you really do want to have an open door and be open to share. Dr. Blue knows, he can call me anytime, and we'll talk. And I don't, and really, I use myself a lot, to give him my opportunities, where I had troubles and what I learned along the way, and really try to validate, where he is and what he's trying to move forward. And I really, I really do have a policy. I really do make time, for anyone that needs help, needs counsel, need whatever. Even if they just simply want to call me and just complain, that's okay, but then we're gonna develop a plan and move forward from that. But you really do have to make yourself available. You really can't forget where you came from. You don't forget your struggles, share your struggles, share your opportunities, share your failures, share it all, and really just make yourself available.
Great. Dr. DeVera, if you want to jump in on that, how have you or paid it forward, or how you plan to pay it forward?
I think one of the key difficulties that I had upon progressing in my career was I realized I was so ill prepared. Like, what's nursing hours per patient day? How do you balance the census or the schedules? Something as in, like, I didn't even know what an agenda was, right? Like, okay, we need a meeting, we need to make an agenda. So what I did was, one of my key projects in University of Washington was piloting the first ever leadership development program based on the American Organization Nursing Leadership Standards, and also integrated some of the principles that I learned from my MBA from MIT. So it included patient safety, financial management, systems level thinking. And what was most fulfilling about that program was, out of the 66 graduates, 50% identified as a person of color. And out of that number, 33% who were promoted actually came from diverse backgrounds. So I think as leaders, we can actually create structures to support the next generation of minority nurse leaders. And aside from that, the didactic part of that leadership development program, I also designed a once-a-month 30-minute meeting with an executive leader, meaning who do they want to be in 5 to 10 years? So I actually mentored around 3 to 4 minority assistant nurse managers, and thankfully some of them actually got manager roles already. So I think it truly is an investment of time and being intentional on how you help the next generation.
Excellent. Captain Dickens?
Yeah, I think one of the things that both my colleagues alluded to, you're making yourself accessible and visible, and you have to be willing to advocate for people that that are worthy of these positions. Whether you're looking at advancement opportunities, you have to be able to say, hey, I think such and such would be a good candidate for this position, because these conversations are being had, right? We're talking about the haves and the have-nots, and those conversations are being had, and we shouldn't be afraid to I think that's a song, Put My Name on It or something like that. But we shouldn't be afraid to put our name on it, but we should know what we're dealing with when we put our name on it to endorse the young Dr. Michael Williams. I should know that he's from good salt, and I need to be able to put my name on it, or put some spec on my name. There you go, Dr. McCamey. She saves me all the time, but yeah, put some spec on my name. And so when I advocate for Dr. Williams, I'm advocating from a point of, I know what he brings to the table. I know that he can do the job. And a lot of times people aren't willing to put themselves out there. So you ask what I'm doing personally. I mentor a person every Friday. I have an executive coach through my agency now, and John Maxwell talks about in one of his books, one of his many books, he talks about everybody can make an item. You know, we all could start a company and make a pen and replicate it. But what we can't replicate it are those human resources. And that's the key to the secret sauce. So most organizations are going to put money into their human resources or human capital. And so I would tell you to tap into that. See if they have an executive coach. You know where I found my first executive coach at? Is like on Fiverr or Upwork. I just contracted with somebody that knew government coaching and did coaching as a hustle on the side, and I got it. Now, this is my third or fourth coach my agency has paid for. When I was with the Office of Minority Health, they paid for the coaching. Now CMS pays for me a coach, and I just got that extended. So be willing to invest in yourself, right? And be willing to move out there, but also, again, be visible as a leader and be accessible as a leader. And I think Dr. O.G. Williams and Dr. Blue talked about, you know, bouncing things off each other. And you also need a safe space, right? You need a Dr. McCamey in your life that you can go to, or someone that speaks your language, Dr. Veyra, that speaks your home language, that you feel comfortable with, that you can have some limpia and pansit with, and you can be okay, right? I was trained by Filipino nurses in Virginia Beach, but I'll leave that alone. We can talk offline about that, Dr. DeVere. But but my point is that you need to be in a comfort zone, and you need to have that space where you can vent, and you're not going to be judged. If that's okay, I'll stop there. Over.
Listen, I was trained at the RN level from Filipino nurses, and you know one thing they gonna do is not play about that work, and they don't got no problem cursing out anybody if the bed or one sheet or one hair is off when they come on, they on you. So, Dr. DeVera, I'm gonna start with you for the next question, and I think you touched on structures, right? As a man of color, a Black and brown individual in a nursing leadership position as a male. I guess what are some crucial support systems that you need at play to be successful in this role, I guess?
I think it's easy, right? Look around you in this Zoom meeting, right? I think finding your community is the most important aspect of your journey. Because in the end, we will not succeed because we believe in ourselves. We will succeed because we believe in each other.
Excellent. Dr. Michael Williams, if you want to go ahead.
Yeah, I agree. And also, I think you need to have some balance. You know, you need support systems within and and outside of the organization as well. You know, you do need to, you know, have some balance in these jobs. You know, if they won't stop you from working 80, 90 hours, you know, a week, that, you know, and so if you can't have someone in your corner that'll tell you, hey, you need to have some balance, you need to take some time, you know, you'll work yourself to death. So I agree with Dr. DeVere. We need this forum, but you also need to have some balance. You need support systems, you know, outside of the workplace, really to support you through these series.
Excellent, excellent. Dr. Dickens, you want to finish us off there?
You know what? I wish I had something to add, but I think they are, and I want to be respectful of the time, but I think my colleagues were spot on this one. I just don't have anything to add. I know that's surprising, but I don't.
All good. So I guess we're gonna switch gears into, you know, future outlooks, because I want to thank you, panelists, and you men for taking the time to do this, because I think the impact of this conversation might not just be for now, but 20 years when we got some other brothers looking back at the video and watching these gems, I think it's gonna hold so much weight. So as far as future outlooks, I guess what do y'all see, or what changes do you foresee in healthcare leadership for Black and brown male nurses in these positions? Oh, I'll start with Captain Dickens then.
Yeah, I just think I think you're going to see an upward trend or increase matriculation of more people, because you have people like Dr. Williams, Dr. DeVere, and others on this call, Dr. Aileen, and what have you. And I think someone used the word intentional. And I know that's been thrown around a lot with DEI over the last few years, but being intentional in these spaces and making sure that we never stop learning. We never stop reading. We never stop. I mean, we're lifelong learners, period. And if you think you aren't, you wouldn't be on this call if you weren't. And so I would encourage you to embrace that. Don't silence it, and don't allow anyone else to steal your shine. I think that's a song or somewhere along my upbringing I heard. Don't let anybody steal your shine, man. Be you. And haters gonna hate. And guess what? I'm gonna give them something to hate on, because I'm gonna continue to do me, and I'm gonna be the best version of me than I was yesterday, and I'm gonna be a better version tomorrow. So that's what I would tell you to do, and I'll stop there.
I'm gonna go ahead and pass it on to Dr. Veyra. What changes you foresee for us in a leadership role, I guess?
I agree with Captain Dickens. There's just too many people drinking haterade, right? So but in all seriousness, I think finding your community and finding your tribe is imperative, but also be investing in yourself, right? It's really important to have mentors. So, for example, if I need to talk about clinical scholarship, I have Dr. Danielle. If I want to learn about hospital operations, I can probably reach out to Dr. Michael Williams. So I think the key piece to this is finding your community and finding that one person who can help you, wherein you can just call or text and just solve a problem. Because I think that was the key difficulty I had when I was progressing. I had no one. And once I found that community, once I built these network of mentors, I became much stronger and prepared for the challenges ahead.
Thank you for that. We're gonna have Dr. Michael Williams go ahead and close us out on this question.
Yeah, I think it's positive. Yeah, I think having these forums, I think, the connections that we can, that we'll make, from this forum, I agree. You've got to have someone, that you can call, someone that's going to keep you grounded, someone that's going to tell you, not to make a decision when you're angry because you don't feel like things are going your way. And I think it's going to be good for us. We really need to continue to network. I'll be the first to say I'm not a big networker, but it's something that I need to do more of. And make myself available. To be that voice of reason at times when it's needed. And so I think it's good. We need to speak up though. When it's not right, we need to speak up. When those opportunities present themselves, we need to be encouragers of our leaders. And to have them, put themselves out there. And we need to be okay, letting them know you may fail, but that doesn't mean that you're going to quit, that you should quit. You should continue to press forward. And so I think, by sharing our stories, our failures, our opportunities, I think it's going to be good because I think, others will see that, you can succeed even with failures.
Thank you. And, Dr. McCamey always say, somebody's going to be looking to leverage the gems of information we have here. So it should not only be about what we could do, but also what message you got for these organizations, for these spaces that we operate in. What do you have to tell them to say? How do you support, right? How do you support and promote, just men of color in these nursing leadership positions? If you would want to start, I guess I'll throw it to Dr. Dickens.
Hold them accountable. Hold them accountable. And, it took me, I've been a member of AANP, American Association of Nurse Practitioners, for almost 30 years. And it took me about 12 years to get because I told them minorities matter before Black Lives Matter. And it took a long time to get this committee up running. And I'm happy to say we were pre-George Floyd. A lot of things happened post-George Floyd, right? But we were pre-George Floyd because I had mentors, leaders within the organization, African-American leaders that I wanted to be like, Sheldon Fields, and others that I wanted to be like, Randy Rash, Dean Rash, Dr. Rash. And so I hold them accountable. Hold them accountable. And your dollars matter. right? Our dollars matter. And I can say this, Dr. McCamey saw a need, and that's why we have DNPs of color, right? She saw something out there that was needed, a void, and she made it happen. And so when you have these organic ideals and things that are come to you like this, don't sit on it. Talk to like-minded individuals and see how you can make it come to fruition. So I would just stop so my other colleagues can have time to discuss, but hold them accountable and use your voice, as Dr. Williams mentioned.
Excellent. Dr. Williams, how would you want anything to add to that as far as message to the healthcare org or the organizations in promoting and supporting us in these nursing leadership positions?
Once again, I agree with Dr. Dickens. Hold them accountable. Be the example. Show them the way. Show them that we are capable. And that we do have the skill set to do it. And then call it out. And oftentimes, you do the work and you don't get the credit. And sometimes we're very humble, but you need to take credit for that work. And we need to let them know that we're doing this work. And that we are able to do this work. And so. The one thing I'll say is, I was one of first, but I'm happy to say I wasn't. There were seconds and there were thirds, and so that makes a difference. Because someone had to show them that we can do the work and that we're capable and that that we are making a difference. And so once again, I agree. Hold them accountable, but take credit for the work that you do. And really make sure that they understand that this is where this work is originating from.
Excellent, Dr. Veyra.
I think one key piece of advice is to ensure that there are processes in place to protect diverse populations from microaggression. One of the key projects that I was involved in was being a part of the bias reporting team in University of Washington, wherein we would actually have these anonymous reports, and an executive leader will reach out to those individuals that were victimized by microaggression. So being intentional and trying to build these structures, and in the event that these structures are in place, partake in it, support it, and advocate for it.
Excellent, excellent. So I'm gonna pass it off to my colleague, Dr. Blue. Let him bring us home. But thank you, gentlemen.
Yes, thank you. I have been sitting here kind of ensuring that I get through the chat to see if there are any questions. And let me tell you, the questions that we've asked my brothers here, they have answered. There aren't any questions in the chat. Everybody's saying, pray church. We at church right now. And I'm telling you, we have learned quite a bit. I'm almost stumped. I've been jotting notes and it's like, where do I start? My whole paper here is full of stuff. And there's just a lot of nuggets here to really pull out. One that resonates with me from what each of you have brought across was, and it's very similar to my mantra from my alma mater, University of San Francisco, whereas you can change the world from here. Meaning you don't have to go 10 miles away, 50 miles away, or even make yourself different from who you are, presenting yourself. You can be you and be right here. And the differences you make can really spread. And so that was one thing that I really took from this. Also, having a tribe, making sure that you are part of something, and really looking at ensuring that if you don't see it, go find it. It might not be readily available to you, but if you want it, sometimes you've got to put your foot out there and make it happen. I can, come back to Dr. Michael Williams, number one. And no, when I got to St. Joseph's, he and another colleague, Dr. Anitra Williams, who was my former chief nurse officer, really kind of paved the way for me. I came in as a manager of the neonatal ICU. I sat down within 3 months of being there at St. Joseph's, sat down with Dr. Williams and the other Dr. Williams as well, Dr. Anitra Williams, and gave them my strategy, my gap analysis of my unit, and told them where I wanted to go and how I wanted to take it. And they both looked at it and says, yes, we got you, right? And then I said, you know what? We don't have a pediatric service line. And I said, I'm your guy. You know, we're building a new unit. I can take us to the next level. And both Dr. Williamses got behind me and advocated for me. And then I became director of a new pediatric service line. And let me tell you, if they weren't there to pave the way for me as some of the first, you know, it wouldn't have been possible. I would have probably had to fight so much more and so much harder if they weren't there for me. And they created that space with the like face, right? We talked about that as well. I was truly out of my weight class, you know, when I got there. But let me tell you, having a coach like Brother Williams here really made all the difference. I sat in his office regularly. We tried to have it at least once a month. My brother was busy. Let me tell you, everybody had him everywhere, but he would spend the time with me. And really, I call it a spanking. Every now and again, he'd see an email or what, he would bring me and say, don't send an email like that. That's not going to help you, right? That's being real. And so it made me again reflect, and I was open to that. And so I was able to move forward and take what he had to tell me and really become the professional I wanted to be. And, you know, I'm telling you, all of these brothers here that we've been talking to, you know, as old as I am right now, I want to be like them when I grow up. Let me tell you, there is no time but the right time now to make a change and move forward. You are a lifelong learner. We talked about that, and I have learned today. Dr. Joseph, I am in awe of the accomplishments that you've made, being, you know, coming here as someone who didn't speak English. I've been speaking English most of my life, really all of my life. And, you know, I look at you and I am bowing. It's like, dude, you have done it. And I'm just impressed. And I know that we will need to continue connecting long after this particular session, because you're someone I want in my arsenal. Because again, as we have said, the more individuals you have to support you, the greater you are as an individual. And, you know, I think all of us here understand that, and we continue to build our community. You know, I can keep pulling out little things that I've learned here, but creating that seed, if it's not there, bring it. That's what, you know, my brother, Dr. Williams, told me. And I said, I want to create the pediatric service line. He says, do it. Be there. Be about it. Don't just talk about it. We talked about that as well. Be intentional, you know, and even if it's awkward, move forward. Move forward. So, you know, I hope I hit a little bit from everybody. You know, we were talking about, you know, our good brother Captain here. I was broke, always broke. And nursing has been good to me. And so all I can do now is take what I've learned and this profession to give back. That's where I am. And, you know, like I said, this has been wonderful. Are there any questions that anybody has? You please can come off your mute and ask your question. I'll do my best to try to find you, raise your hand or whatever. And I am open. I still don't see anything in the chat at this time. So we're open for any questions.
Dr. Bull, I thought we were going to start having to go in and get our tides out. You know, this was offering and tides. You laid it down. You put it down like 4 flat tires, brother.
Well, I don't see a hand. Oh, Nikki Washington. Yes, my colleague from St. Joseph's. Go on ahead now.
Hello, thank you, Dr. Blue. I would just want to say thank you to all of the gentlemen on the panel. It was very much refreshing to hear it from a different perspective and also to hear it coming from the male counterparts. So thank you. It's definitely needed. You guys are truly leaders. I am biased to my favorite, Dr. Michael T. Williams. He was my boss when I got to California as an interim, um, in an interim position. And because of his leadership and because of Dr. Anitra Williams' leadership, I chose to stay because I knew I had the support. So it definitely makes a difference when you have that overhead support of people not only that look like you, but have a common goal and have common interest. I agree that things should not be based on certain things, but based on qualifications. And they definitely practice what they preach and they really walk the walk. They are I can't say enough about them because I won't overtalk Dr. Blue. I can't talk long like him. I don't think nobody can. But um, I can talk all night about Michael and Anitra. And I'm very thankful and grateful for both of them, even though he has gone on to different areas in Commonspirit. I'm kind of salty still about that. He's always going to be my boss, and he's always there for me if I need him. I can text him and he can give me advice over the phone. So I just want to say thank you, Blue, for putting this together. Joseph, I appreciate you as well. I appreciate your authenticity and your will and your willpower to keep doing what you're doing. And so thank you to everyone. Again, have a good night.
Wonderful. Thank you, Ms. Nikki. She is actually the director of surgical services and my colleague, and I appreciate her. We bounce things off of each other, and it's been truly great. Again, I have a problem with brevity, so I will definitely stop and just turn it back over to my colleague, Dr. Aline. I want to say Dr. Michael Williams II, my other colleague, and I want to thank both of them for really working with me to promote dimensions. And with that being said, Dr. Aline, back to you.
So wasn't that a great event? If you can show me the hand clap or applause, kind of. And so I appreciate all you guys coming. Lots of nuggets of wisdom. I think Blue picked up all the nuggets of wisdom. But one phrase stood out for me, and I have to mention it: intentional inclusion. So that's important, and that's part of the mission of Dimensions of Nursing. We want the men to be intentional inclusion because they'll be left behind. I can say as the only Black male in my university, I can say, yes, this is important. I had to be intentional inclusion and be loud without being screaming. So if that makes sense. So I had to really push myself into certain areas, and because I felt like I was being ignored and I had to show up and show out. So I appreciate all you guys. We do have some more things in the works. So please stay tuned to more events like this because we truly want to, we have a lot of ideas and we have a lot of plans to uplift minority men in nursing and also just men in general. We want to impact, we want to get global, impact all men throughout the country, minority men, and show what we can do as nurses. So I appreciate you all. And I'm just full of joy. This was a great event, and this has been a dream of mine to kind of see this coming to fruition. So you guys don't know how much it meant. So thank you for all the panel discussing. And Nikki, you got a question? Go ahead.
No, I don't have a question. I forgot to tell. Is it Dr. Captain? Dr. Cap?
Dr. Dickens?
Yes.
Just
I
plain old James, just plain old James to use this. Just plain old James is fine.
Well, I surely would like to thank you and give you kudos for quoting Shirley Chisholm from the greatest sorority that's on the face of the earth. Thank you very much for that.
Absolutely. I'm down like 4 flat tires with you. So anytime I can give the shout outs, it's great. I just can't remember who says it now these days. So just charge it to my heart and not my mind, or my mind and not my heart.
Thank you. So shout out to all the panel. Thank you all to the panel discussing participants for sharing your insight. So I appreciate it. And like I said, keep an eye out for all. Oh, we got a lot in store. We have a lot. So this ain't nothing yet. You haven't seen nothing yet. So be ready and prepared. But thank you guys. Hope you guys have a good evening. You take care.
Thank you.
All right, y'all.